Welcome to Charter California Edition. My name is Brad Pomerantz, and we are here with the chair of the San Luis Obispo County Board of Supervisors. His name is Bruce Gibson. He is running for re-election. That election will be held in June 2014. And so I want to speak with you about the Affordable Care Act. And I speak with you as someone who represents a nice mid-sized county. You're not LA, you're not Alpine.
Right.
You're kind of right in the middle.
Right. Sweet spot.
So, you know, I have no dog in this fight, if I can use that cliche, but the numbers do seem quite positive when you look at California and those that have signed up through Covered California.
Absolutely. You know, I think it's going to be a major economic boon. And, you know, I've read studies where the health and well-being of employees is a major contributor to the success of companies.
Right.
So,
and it's funny you say that. I was speaking with John Ashbaugh, member of the San Luis Obispo City Council the other day. I don't know if you saw, but Gallup came out with a poll which indicated that the San Luis Obispo area is the #1 metro area for employee satisfaction.
Right, exactly.
In the whole country.
Exactly. Easy, you know, easy, and it's obvious and easy to understand why that is.
Right.
But, you know, taking care of basic health care needs, you know, is so fundamental to an individual's sense of well-being, as far, you know, in my view, at least, and I don't know why that wouldn't generally be the case. And so expanding the ability of folks to get access to health care has got to have a positive effect.
I want to get a sense from you, again, as the chair of the Board of Supervisors in this county, which I would call somewhat a purplish county. I mean, different parts are more blue, different parts are more red. What has the response been to the Affordable Care Act? Have we seen a lot of sign-ups? Have we seen a lot of recalcitrance against it?
You know, I don't know that we track ourselves the sign-ups for Covered California.
Right.
Our function as a county has been to provide a portal to get to Covered California.
Right.
So if someone is wondering about getting health care, they can call the state or they can call us. But we don't keep those statistics. On the street. On the street, you know,
what do you hear?
You get the standard partisan divide on that the Affordable Care Act is going to ruin this country, or the Affordable Care Act is the best thing that has ever happened to health care. I think people are generally accepting of it. I think the experience here, largely because Covered California has had a good track record relative to similar exchanges in other states, I think people have a generally positive reaction to it.
I want to get a sense from you about your sense of the numbers. Look, I've been covering Covered California, healthcare.gov from the beginning. And we know early on the CBO, Congressional Budget Office, expected about 7 million people to sign up. Those numbers got scaled back quickly to 5 million. Maybe we'll hit 6 million.
But it's coming back strong.
Well, on March 31st, the numbers broke 7 million.
Exactly.
No one expected that. In California, the numbers are well over 1 million. And what happened all of a sudden? It turned around.
I think people looked at the ability to get affordable care and realized, you know, there's the mandate part of it, but you know, does the stick work or does the carrot work better? And I think people made a rational analysis and decided that signing up for health care made sense for them. And, you know, I understand the perspective of a 20-something who is invincible. And, you know.
But even the Invincibles signed up. I want to talk about that and more when we come back. For our viewers on HLN, we thank you so much for joining us. For our other viewers, we'll be right back on Charter California Edition. So, sir, let's talk about the Invincibles. We know them as the Invincibles. They are those that are in their 20s up to the age of 34.
My two sons.
Exactly. In order for the Affordable Care Act to work, we needed the Invincibles to sign up because they don't have high health care costs. In the beginning, the Invincibles were not signing up. But as we marched down and through the process, the Invincibles did start. And even in California, while the numbers didn't hit 40%, which was the golden number, they did increase.
And so good for this community, and you know, and good for the future of those individuals, because invincibility is I guess a state of mind, and yet things can happen, accidents can happen, and the ability to get treated for that catastrophic event, I think, is going to start showing itself.
We also must talk about one segment of the California population, the Latino population, which is a huge portion of California, and especially a large portion of the uninsured in California.
Right.
In the beginning, the Latino numbers were abysmal.
Right.
But again, as we got through the end of the enrollment period, the Latino numbers surpassed their population proportion.
Right. And I don't know exactly how that is. There may have been some communication effort that needed to be eventually sink in, but I think that has worked. Certainly, another aspect of it is the expansion of the Medi-Cal program and the Medicaid program, which is going to be a very big deal for this county.
And let's talk about that, because as you know, the U.S. Supreme Court ruled that the federal government could not require states to accept what we know as the Medicaid expansion. As we speak today, I believe about 27 states have accepted the expansion, California being one of them.
And it's going to make a big deal in our ability to take care of those who can't take care of themselves. It used to be in Medicaid, or Medi-Cal as we call it in California, you had to be a child or the parent of a child and very, very low income. Well, in that very low income zone, we now will cover virtually everybody. You don't have to be disabled, you just have to be of low income to qualify. Above the cutoff line, which happens to be at 138% of the federal poverty level, don't ask me why that one was chosen, you are mandated to have health care, insurance, with subsidies as you go up toward 250% of the federal poverty levels. So the actual responsibility of the county now for medically indigent people has been dramatically reduced from some over 3,000 individuals in this county down to, we're not sure, but maybe 200 or 300, and we're waiting for that to play out. But I think the key elements here are that a broad coverage in the lowest income segments that includes preventive health care, regular checkups, things like that are going to make a huge difference in health outcomes. In the somewhat higher but still low income levels, again, insurance now is, directed at covering preventive. I think that's the biggest change. We'll still have people who don't have insurance for one reason or another, and the county, as the provider of last resort, has the responsibility to take care of those folks when they have medical need. So if someone gets sick or someone gets injured, they don't have insurance, and they don't have means, then the county steps in with what we call our medically indigent program.
You mentioned preventative care, and part of the goal behind the Affordable Care Act is that folks would use frontline medical professionals for preventative care instead of getting sick and then going to the emergency room. But you need to be educated.
You do.
And so do counties play a role in?
Absolutely, education, outreach. In fact, as we speak today, it's National Public Health Week.
Oh, okay, perfect.
And we're out on the street, we are out at farmers markets, we are out talking about the different services that the county offers, in smoking cessation, support for pregnant and nursing women, efforts in the schools, efforts on nutrition, connecting folks with healthy eating and healthy exercise habits. And so, public health is a big deal, and that educational component is a big deal. I think we're going to start seeing it pay off huge. Okay. It's going to take some years. I think people are going to have to realize that taking care of these chronic problems of diabetes and high blood pressure gives you a quality of life boost that is going to be amazing.
His name is Bruce Gibson. He is the chair of the Board of Supervisors in San Luis County, running for re-election June 2014. My name is Brad Palmer. We'll be right back on Charter California Edition.
Through the end of the ACA enrollment deadline of March 31st, 2014, California had the most people sign up for health insurance through exchanges. Which state came in second? Florida, New York, Michigan, or Texas. Florida experienced the second highest number of enrollment in health plans through an exchange, followed by Texas, New York, and North Carolina.
Welcome back. It's Charter California Edition. I'm Brad Pomerantz. He is back. He is Adam Hill. He's a member of the Board of Supervisors in San Luis Obispo County. And sir, I've said this before on this program, whiskey is for drinking, water is for fighting over. That's Mark Twain's words, not mine, but we are fighting.
Yeah.
These are very difficult times. We are praying for rain. It's really not coming.
Right.
I want to talk about this county, San Luis County, Central California. How is this county doing during this drought?
We are experiencing serious problems, as we're seeing in other places too. Paso being the one place that everybody's been talking about. It's the largest, the Paso water basin is the largest one in the state.
Right.
And it is in steep decline.
Right.
And we have been struggling essentially to get some kind of hold on how we can manage it and how that would look. And it's not been easy.
And let's talk about Paso, and I think it's a great metaphor for a lot of what's going on in the state, because the Paso area has really exploded. This is Paso Robles, has really exploded in the best sense as a result of industry, specifically agriculture. The wine industry in Paso has become really it's a crowning jewel in this community. But we know that grapes use a lot of water. And so it's a real challenge. And I say that specifically as it relates to other produce. It uses much more water than other produce. And so it's a real bind.
Yeah, it is definitely, it's a trade-off that's been made, and now we may in fact be confronted with the results. And one of the things is, as you mentioned, that Paso has really helped to put our community on the map as a destination for wine lovers.
Right.
We're now, after Napa and Sonoma, Paso and the rest of SLO County is really a place that wine lovers and foodies like to visit.
Right.
And so you've seen excellent wines and nice restaurants and all sorts of things that develop around it. You also see vineyards everywhere, and people like that because you'd rather see, it's sort of open space.
And
it's beautiful to see rolling hills of vineyards than to see other things, commercial buildings or houses.
But the Paso groundwater basin is at real risk.
It's at real risk.
And, California, I think, is one of very few states that doesn't regulate groundwater as other states do. And there are tremendous battles going on with regard to the Paso water basin within SLO County.
Yeah.
I don't think you specifically represent a portion of it, lucky you, but still have to vote on it.
Yeah.
Right.
Yeah.
And so, as an example of groundwater basins that are struggling, where do you go from here?
Well, there's a lot of things going on. I mean, we've tried, the stakeholder groups themselves have tried to come together to form a water district. And
an independent
water district that we sort of helped to push by passing an emergency ordinance that basically was a moratorium for 2 years. It was sort of a stick to get to the carrot, which is,
and what's happening with that?
Right now, it doesn't look like Sacramento, though our Assemblyman Cacho Asajian was willing to carry it forward. A lot of roadblocks came up in Sacramento. We're still sorting it out, but we're not real hopeful to create
Sacramento.
We need them to be willing to pass a piece of legislation to create a different kind of district than the sort of off-the-shelf kinds that are already approved.
What's so interesting about San Luis Obispo County is that in some areas, water is aplenty. I think the city of San Luis is doing all right.
City of San Luis probably has the most water secured.
And yet Paso, just up the road, really struggling. And I mean, just up the road, literally. Right. And that's what a drought can do. It can really divide communities in terms of the haves and the have-nots. What I want to do, sir, when we come back is talk more about the drought and what we can do to try to eliminate the pain of the drought and whether we need regulation or regulatory reform on these questions. We've been speaking with Adam Hill. For our viewers on HLN, thank you so much for joining us. For our other viewers, we'll be right back on Charter California Edition. So, sir, I was recently in Washington, D.C., interviewing members of both the House and the Senate, and specifically in the state of California, interviewing both Democrats and Republicans. And I think it's fair to say on this issue, there's a very significant divide. On the question of what to do about the drought. The divide falls in two areas: on the question of storage, do we need more storage? And on the question of regulatory reform. Let's talk about storage. There's a bond that's being floated statewide. What's your sense of whether we need more storage or do we need to improve storage that we have?
Probably both. I mean, I think we're in a situation where everything has to be on the table, and it's not an either-or situation. Is storage going to be enough? No. Should we increase our capacity to store? Sure. I mean, if we can do so, that I think would help.
It's interesting. I say the word storage, but if you translate, that means dams.
It means dams of some kind.
Right, and those are fighting words to some.
Those are fighting words to a lot of people in the environmental community especially.
And so, but is there a consensus, both on the left and the right, that we need to do something on the question of storage?
Not yet. Really? I mean, that's the problem. Just as the right saying that we shouldn't have regulatory reform, at the same time that a lot of us say, well, you know, we're a state that doesn't regulate the groundwater, so what's going on is partly the result of that. Because you can just keep putting straws into the ground until you come up with water. And we're seeing that all over our county. I mean, not just in Paso. We're seeing it in South County. We're seeing it in my district, where people are just having to drill new wells to be able to find water.
And as I understand it, we actually have a sufficient groundwater supply if we just manage it properly and recharge it and avoid subsidence. I mean, we have what we need, we just aren't managing it well.
I think that's certainly true, though, you know, there's a certain amount of people that say that's going to get harder with climate change and some of the things that come from that.
Right.
But I think there would be less of these issues if we did have a management structure throughout the state that made sense and that really took care of the resource.
So let's talk about regulation, because we often hear this whole notion that we're putting fish over families. And when I talk about fish, I'm talking about the Delta smelt.
Right.
And we know it's a tiny little fish. It's about 2 inches long. And whatever you think about it, that's almost irrelevant, because the courts have been extremely clear that the Delta smelt is in decline, and decision after decision protects the Delta smelt, and that causes, you know, the faces of many folks to just turn bright red, beet red, because as a result of that protection, we see arguably water being sent out for purposes other than human.
I understand the frustration on that, and I mean, if you narrow it down to that, we remember seeing that probably back in the 80s with the owl and logging. The issue really has to do with biodiversity and what the impacts are when you start to continue to remove species. But you know, you also hear people say in our region, well, and I think you brought this up before, which is we're using all this water on wine grapes rather than row crops and other things that we really need to eat. People don't need to drink wine necessarily to stay
I don't know
alive.
about that, but yeah, be that as it may.
I'm not arguing that one
yeah.
way either. I enjoy our wines very
Right.
much, but I'm saying, you know, you could look at all sides of these arguments. People could say, like, you know, if we were just going with row crops and the kinds of foods that families need most, that we would have more water available. So that might be another side of the why are we saving the smelt.
But at the same time, think about how much money is generated, $45 billion, the ag industry to the state of California.
Yeah.
We are the salad bowl to America.
It's hugely important.
And, you know, if all of a sudden ag starts to dry up, that's a recession we don't want to see.
It's a disaster if that were to happen.
And especially on the Central Coast. I mean, I think about Santa Barbara County, St. Louis County, Monterey County, and then you go to the Central Valley, Fresno, and Tulare County. I mean, it would be absolutely devastating.
It would be devastating locally, nationally, internationally. Yeah.
So where do we go from here? What can you and I do just as regular folk?
Right.
What can we do?
Well, there's obviously, you know, the governor's put it out in a voluntary way, which is asking everybody conserve 20%. So one thing that most homeowners can do, most people in families can do, is just look at how you use water and cut back. You know, whether that's looking at your landscaping, which is where a lot of water is wasted, whether it's looking at how you can make your home more efficient if you have money.
Right.
I think spending money to make your home more water efficient is useful.
And I understand there are rebates and programs from the government that can make it more, you can amortize it more effectively.
Yeah.
Flushing toilets.
All sorts. I know.
Yeah,
well,
I'm
you know,
just saying.
we've been through that before with
Yes.
droughts, and I mean, there's a lot of ways. Unfortunately, almost all the water that we have in our homes and that we use in our yards is potable water.
His name is Adam Hill. He is a member of the Board of Supervisors in San Luis Obispo County. My name is Brad Pomerantz, and we're going to be right back on Charter California Edition.
The Delta provides what percent of Southern California's water? 5, 12, 23, or 30%? Southern California receives 30% of its water from the Delta.
Welcome back. It's Charter California edition. I'm Brad Pomerantz, and we are joined by Debbie Arnold. She is a member of the Board of Supervisors in San Luis Obispo County, which is interesting in so many ways. I was recently speaking with John Ashbaugh, a council member in San Luis Obispo County, and he showed me a survey which indicated that San Luis Obispo is the best place to work according to its residents of the entire nation. Gallup did a survey, the entire nation. San Luis Obispo comes out number one. But there are some challenges as well. There's a homeless population. People are coming to San Luis because it's the happiest place in North America, it's the best place to work, and sometimes they fall on hard times.
That's right. And San Luis Obispo is known for its compassionate populace. And of course, we have good weather.
Right, clearly.
Yeah.
But do talk to us about the recent economic downturn and what that has caused with those that are in need. Because when you walk around the county, there are pockets where the homeless population seems to be more significant than you'd expect.
Well, absolutely. And, you know, the homeless population, like any other population anywhere, you know, it's a little bit diverse.
Right.
And you have people that become homeless for different reasons.
Right.
Now, to some, homeless has become an acceptable lifestyle. We have veterans that are out on the street that have become homeless for one reason or another. We have a chronic homeless population, and then we just have,
resistant,
as you said, families that have fallen on hard times and become homeless just suddenly through really just no luck, or down luck or no fault of their own. So those different segments of the homeless population require different services to help them.
This is what's exciting to me. I mean, so many folks believe that government can't work together, that there can't be collaboration. But when I think about the recent announcement between SLOCOG, which is the San Luis Obispo Council of Governments, the SLO RTA, which is the Regional Transit Authority, as well as the Community Action Partnership, in consultation, in collaboration with the City of San Luis Obispo and the County of San Luis Obispo, to meet the needs of both transportation and homelessness. Wow, congratulations.
Well, thank you. And I am very excited about this project. And as you say, it is a perfect example of agency collaboration to really come up with something that'll be a great solution to several problems and efficiency for the taxpayers. The Regional Transit Authority is just that. It regionally provides transit for all the cities in the county. They presently lease their main facility where they keep their buses, mechanic their buses, and you know, it's their switch yard, if you will. That lease will come up due, be over in just a couple of years, and they are presently in search of a replacement property to house themselves. CAPSLO, which is a community action partnership of San Luis Obispo, actually contracts with the county and several of the cities here in the county to do some of the homeless work and provide homeless services. They too have a need and have been talking for a long time about building a new homeless service center. It would be more than a homeless shelter. It would be a homeless service center that would provide services, the caseworkers, etc. Both of them were looking for suitable property, and this exactly. And to be able to partner, it's a win-win situation.
And I want to really talk about that partnership because it is pioneering, it is innovative, and in so many ways, it does show that, like you said, agencies that may be completely disparate. Who would think transportation and homeless services could come together to create an integrated unit? That's what we'll talk about when we come back. For our viewers on HLN, I want to thank you so much for staying with us. For our other viewers, we're going to be right back on Charter California Edition. So let's continue this conversation and talk about this partnership. Explain to us the location at 40 Prado Road for our viewers statewide, please.
40 Prado Road is a 9+ acre property right along the freeway, and it has some issues that made it difficult for commercial building, but in this case, the perfect opportunity for the Regional Transit Authority and the CAPSLO to be able to build a homeless center. There are no neighborhood issues. It's actually just across the street from the present homeless shelter. So that's an area that...
What's there now? Is it empty? Is the lot empty?
The lot's empty.
Okay.
It's just empty. And the the purchase is
Right.
going forward now,
Right.
and once all of that is finished and finalized, then RTA will own its piece, and it's, I think, 2/3 of the
Right,
property.
that's right.
But they will keep their buses there. It'll be the major transportation transit hub in the county, and then right next to it will be this new homeless services center that will not only provide shelter but will also provide services in the same vicinity, and the transit center will be right there to be able to service the homeless population.
On so many levels, it is remarkable. And when you think about the funding for the project, it's coming from different sources within the government as well as the nonprofit sector. You have money coming from the state. You have money coming from the county, I believe.
That's right.
You have money coming from the nonprofit sector, CAPSLO. I'm not sure if the city of San Luis Obispo is contributing, but at a certain level they'll be involved because it's in city land.
They absolutely will
Right.
be, and the community itself, a lot of donations coming
Right.
in to help facilitate this. And the thing is, neither one of these agencies would have been able to purchase that particular property on their own. It was too big for the individual use
Right.
and too expensive. But by coming together, and like you say, two
Right.
different agencies that,
How did this happen?
well,
Do you
we're
know?
still a small county,
Right,
yes,
yes. How
because
did this happen?
actually all of us as Board of Supervisor, you sit on the Regional Transit Authority,
Got it.
and many of and all the cities have a mayor
Got it.
on the board as well. And then many of the same people then are involved with the homeless issue.
Right.
Myself, I'm on the CAPSLO board as well as the Homeless Services Oversight Council. But I mean, it's still a small enough county that you
Right.
visit and you talk,
Right.
and everybody,
Right.
it's not. We don't live in such a big area that
Right.
even the agency executive directors,
Right.
et cetera, don't know what each other
Right.
are doing. So it all came together, and then it just kind of grew support to move forward with this, what I think is an amazing opportunity.
So where does the project go from here? The purchase is moving forward, about $2.25 million. Then there'll be money needed to actually build. Where does that money
Correct.
come?
Well, CAPSLO will be launching a fundraising campaign,
Okay.
so that hopefully the community can come together, and it looks like they will,
Right.
to be able to build the building
Right.
that they need for their homeless services center. And then the Regional Transit Authority will be funding this. It's a needed facility.
understand.
They'll be needing it. So
Right. And they
through
won't
their
be
budget,
leasing anymore. So now they'll
No.
own the facility, which should
It'll be
save money to the taxpayers.
absolutely, it'll be a better deal for the taxpayers.
Talk to us if you know about the Homeless Service Center. Do we have a sense as to what will be provided to the clientele?
There at one time, there was a Higuera site that the county
I
had
remember
donated,
this.
and at one time there were plans for the building and exactly what the center would look like. Right now, I couldn't tell you
It's fine, yes.
absolutely, but once the property's secured,
Right.
I think that then will be the time that they'll be drawing up plans for the service
Right.
center in this location and what exactly it will look like. But it's the intention that it will be able to provide the services right there on site.
Right.
Health services,
Mental health.
case workers for the homeless population, and then also the shelter that they need.
Do we know what's going to happen to the property across the street?
Well, actually, the property across the street belongs to the city, and eventually they were going to need that. It would be part of their wastewater treatment need.
Right.
The property itself. How long down the road that would be, I can't say.
No, you're
Someone
county,
else could
right.
tell you, yeah. But yeah, so this will be a permanent home for a homeless
Do
services
we have a
center.
sense as to when we can expect groundbreaking?
I don't know for certain, but it will depend on how
Right.
quickly the funding can be
Right.
organized.
I must say, congratulations. There are so many folks who believe that government can't work. And in this case, we see that government came together to make it work. You should all be applauded for the hard work you've done to create this collaborative effort. Her
Thanks,
name is
Beth.
Debbie Arnold. She is a member of the Board of Supervisors in San Luis Obispo County. I'm Brad Pomerantz. It's Charter California Edition.